Depending on whether there's questions or comments, we'll collect some of the questions and then I'll give the panel possibility to respond to those questions. So who wants to be first? All right, please, over there.
My name is Peter Sioen. The pronoun is a he. I'm a psychologist, but I'm currently studying international human rights. This is a question, and I wonder, are we talking about two completely different things? On one side, people who are trans, binary, gender fluid, etc., and may have or may not have mental health issues coming from that. And on the other side, people who are traumatized, have mental health issues, and as a symptom of those mental health issues, go to a period or have a persona that is somewhat trans or gender confused.
Yeah, thank you. Other further questions, comments, interventions? Yes, please, thank you.
My name is Manisha Dhakal. My gender pronoun is she, her, and I'm from Nepal. I want to share some story in Nepal that you might know the traditional healer in Nepal. There is in hilly part. There's so many traditional healers. The traditional healers are those who treat the patient, their illness and sickness as per their spiritual practices. They are a religious background, and our parents, many of the transgender parents, bring us to traditional healer for the conversion therapy. So it's not only the medical doctor, practitioner, and the policy label that we need to advocate, but the country like Nepal, we need to advocate these mental health issues to the traditional healer also. One of the story that I heard that Subika, who is an adolescent, very young trans woman, her parents bring her to the traditional healer to change her gender identity and gender expression, but it wasn't success. And one of the local people, they talk about our organization, and their parents bring to our organization. So our organization provide the family counseling. So family counseling is also very important part to change our lives. So I want to flag these issues. Thank you.
Thank you. Yes, please.
So, good afternoon, everyone. My name is Yaya Imyat, and I'm from Myanmar, formerly known as Burma. In my country, seeing a psychiatric is kind of like you are mentally deficient. And for those who dare to go and see this, the resources are very scarce, and then some providers will go beyond their ethical conduct. And sometimes this is a huge barrier for us to access these services. So more community-based friendly services for transgender people should be in place. And personally, I have type 2 diabetes. I go to clinic, and while waiting to be treated, some nurses gossip about my gender identity and expression in another dialect, assuming that I do not understand them. But then being an ethnic minority, religious minority, and transgender woman in my country, think of what kind of trauma I'm going through from this experience. It is not just one time. I have to go to clinic regularly. And then not many transgender people are open. They are reserved, and even though they are strong, it does not mean that they have to undergo this every time they go to look for these services. And how will you ever go again to get treatment under these circumstances? Thank you very much.
Thank you. Yes, please.
Hello, my name is Doug Janoff. My pronoun is he. My question is about the use of the term third gender. I work for the Government of Canada, and there's a now review of changing documentation and various processes. And my question is, if we, I know that some countries have used this terminology, and then I've also heard other criticisms that increases pathologization by creating a third category. So I would be interested in hearing different sides of that debate. Thank you.
Thank you, and I think I saw a hand over here, Dodo. All right, and then, oh yeah.
Yes, thank you. My name is Dodo Kashai. I want to thank you all for the wonderful panel. I think this is one of the most fascinating panels I've ever been to at the UN space. And as Mauro said, there are many, many layers to the issues that we talked about here, and I would like to talk about one. Back in Berlin, I'm part of a group of trans and queer people who live with mental health problems. I'm also a trans non-binary person with mental health problems. My pronouns are they, them, by the way. And in this group, we often talk about what options we have when we're going through a crisis or when it's going to happen again. And that's always an extremely scary discussion that we have because there is no safe option. Often your only option is to go to psychiatry or to be forcibly detained and treated. One of our members in the group was forcibly hospitalized a few months ago. He was grabbed by a policeman in his apartment and he was locked up in a psychiatric institution in Berlin. He was then physically restrained and suffered physical injuries from that, which had to be operated on later. When we're going through a crisis, we're at our most vulnerable. It can be extremely scary, and in times like that, what we need is safety, we need understanding, we need patience, and we need support. Definitely not being locked up, definitely not being treated against our will, or being surrounded by people that we don't know and we cannot trust. No one should be forcibly treated or detained because they have mental health problems. And I was very happy that the Special Rapporteur made that very clear in his report, that the Convention on the Rights of Persons with Disabilities states this and leaves no doubt about it. So has the Special Rapporteur on torture, for instance. I was slightly disappointed, though, because at the second part of the report, the Special Rapporteur was calling for a gradual decrease of forced treatment. And the freedom from torture is an absolute right. There is no excuse for torture. And a gradual decrease is something that we cannot accept. So I really hope that you're going to be calling for a reaffirmation of the CRPD standards in the future. Thank you.
All right, thank you for that perspective. Could I see all hands of all people who would like to make an intervention so I get a sense of, all right? So maybe I'll take one, two, and then I'll give it back to the panel, and then we'll have another round of questions and comments. All right, Keenan, and then.
My name is Keenan Russell. My pronouns are they, them, and I work for the Asia Pacific Transgender Network based in Bangkok, Thailand. I'm going to be making an intervention, though, about a larger conversation. According to the U.S. Trans Survey in 2015, 58% of non-binary people assigned female at birth, and 51% of trans men are survivors of sexual assault, rape, or child sexual abuse. Additionally, around the world, corrective rape and forced marriage for transmasculine people, in addition to lesbians, for whom this violation of their rights is much more widely reported, is rampant, though statistical and qualitative data on this group do not yet exist. The vast majority of sexual assault support groups and resources are focused on female-identified survivors and generate spaces that are uncomfortable, misgendering, and often re-traumatizing for transmasculine and non-binary trans people. There's a dearth of resources for mental health professionals, in particular trans-friendly ones, in providing support to these survivors, as the intersections of one or more of trauma, internalized transphobia, and dysphoria, as well as the lasting impacts of sexism, misogyny, and socialization exerted on those bodies assigned female at birth must be accounted for. At the moment, to my knowledge, there exists only one resource for these survivors, a secret Facebook group dedicated to conversations for them that is disseminated only by word of mouth. Clearly, this is not enough. To adequately and fully support and promote the mental health of trans people, it is vital to promote mental health paradigms that take into account the complex interactions between trauma, identity, and healing. Thank you.
Thank you. And last intervention for this round.
Hi everyone, my name is Fritz. I'm trans activist from Ukraine. My pronouns is he, and I have a small intervention when we talk about doctors and how many doctors are here. There is no endocrinologist in my country for trans people at all, and I think that we should find a way or manage something to do some programs for students or scholarships for trans students who studied medicine, because for example I studied medicine but I cannot give my diploma because I'm trans man. Thank you.
All right, thank you. I'll give it now back to the panel to respond. If I've counted correctly, there's been 3 questions, one on the 2 aspects of mental health, one from the pathology, and one as the result from the pathology of the identity. The question on the third gender, which was more of a legal question, if I understood that correctly. And then the question on the gradual decrease to Dainius. So who wants to respond from the panel first to any of these? So, you want to go ahead, Mauro?
No, I mean,
Or maybe we take the same order of speaking as in the interventions. Do you want to maybe start, Vitit?
hello. The title that has been used has happily become slightly more expansive, and this is also linked with the Idaho statement that many of us made together early this year. So it's trans and gender diverse, and we talk about gender sexual diversity. So it's really trying to accommodate a variegation of possibilities. And some people might not wish to be classified at all, you see. So this might respond also to the question, well, should you have a third gender category or not? In my local language, third gender doesn't sound very good, actually. You know, there's a certain nuance about it. And even when we were doing the national AIDS policy a few months ago, I raised the issue. I said it's better to use the word trans. But some people might not identify like that either, you see. So the title of today, as well as the Idaho statement, was trying to go slightly beyond. But having said that, we also have to try to bridge build and convince others who are less convinced, because some people don't click at all in terms of a plural notion of possibilities. That's life, but it's a challenge on which we need to work together. Secondly, as I said earlier, I was very happy to meet a trans nurse. And I think what's being hinted at here also is that we need more trans people in these various medical professions, psychologists, psychiatrists, and so on as well, as part of the empowerment of people by being part of the professions themselves, if they wish to be. But at the moment, there are very few. And peer help, peer assistance, peer role modeling, all these are very helpful in terms of empowerment as well as the possible rendering of services through communities that are near each other in terms of a certain understanding, while of course we don't neglect others that we wish to see in terms of a certain understanding and empathy towards trans and gender diverse people. And thirdly, my own hint in the presentation was that I'm against forced methods, but I wanted to hear directly from you. And there are many shades of forced methods that we're hearing about, and under the Convention on Persons with Disabilities, I actually appeared before the committee on behalf of my country, and one of the biggest issues is mental disabilities, and it's a very hidden area in terms of the violence which has to be dealt with. And what is the third party that can come into play to help? It's not a very easy thing, because especially if the trans groups themselves are sort of already stigmatized and marginalized, What is the third force that can help us? Very often we have to deal with boards, government boards that come into play in terms of looking at some protection. But these boards are actually not very empathetic towards helping trans groups and other persons if they have to be dealt with under the mental disability law, for example. So it's very interesting that the Committee on the Rights of Persons with Disabilities is very untrusting. It doesn't really trust the third party existence very much at this point in time, and much prefers to go to the persons themselves, the groups themselves who would be affected by these mental disabilities laws. But here again, I wish to reach out to how to bridge build with the state itself, where you have all these boards and third-party interventions, not just psychologists, but others, you know, government boards, sometimes with some NGOs as well who are there. So what is the preferred modality there? If one is to have a third party somewhere along the way, and it's something that we have to think about and negotiate. And I welcome the possibility in future of some of us at least reaching out to the medical professions and scientific professions a bit more in terms of dialoguing with them and identifying the doctors who might be more empathetic than some other doctors and who might work with us so as to enable an understanding approach on this issue.
Thank you for the questions. I have some comments. First is on mental health issues which people may have. There is very often a quite painful debate between two sides, and especially in our post-truth era, then our opponents misuse evidence and they turn things around and they tell you, do you know how often LGBT people have mental health issues because they are LGBT, because they have sinful life or something like that? They get depressed and suicidal because of that. So we know that the causes of this is not in these people, but in attitudes of society, in hate, violence, and bullying and discrimination. So but I just have to remind that this is a very hard and painful talk, and we have to be ready for such painful debates. This is all also about simplistic attempts in medicine. In many systems they try to be white, black, so then they want to have these binary things like man or woman, and please don't create many genders. All this panic is escalated that now there will be more and more genders and so on. So this white and black is also in mental health, that common sense wants to be very simple about who is normal and who is abnormal. And these classifications feed these common sense errors about that we, normal society, we are normal and they are abnormal, and let's try to cure them. The paradox is that the biggest problems are in so-called normal society, which is instigating violence and hate and so on. So the question is, who is more dangerous? And these common sense myths based on common sense, they are extremely dangerous. My next comment is about my position taken in my report on elimination of all force and, let's say, non-consensual measures. Yes, I did this, let's say, tactical thing. This is the way I give chance to opponents, let's say, to powerful groups to be involved in the process, because I do not believe that in this miracle that non-consensual measures will be banned by law globally, or at least in some countries. Psychiatry, for example, most of them, they even don't know about rights-based mental health practices, that they are possible. Absolute majority of psychiatrists is working in classical systems representing status quo, and for them using force is this is how they realize right to mental health in their thinking. And of course, this is wrong, but I hope that the process will start, which will lead to full elimination of non-consensual measures in mental health care. And this is why I know that it's very risky to make compromises if it is a compromise, but this was my decision.
Thank you.
Okay, so I want to make reference to the question about the third gender category. I think that gender systems can have different numbers of genders. They can have 2, or they can have 3, or 5. I think that the point is not the number, but who is controlling gender assignment, for example, at birth, on which basis, and who is controlling movement. So if people can move or not, and under which basis. So if you have a system that allow people to self-identify, like in concordance, for example, with the principles of Yogyakarta, respecting self-determination, and people are allowed to be women, men, and to have the third category, being that an abstract category like third, or being a specific category like travesti or Ehrt, in that case, it's self-identified, it has no consequences in terms of not harmful consequences. If trans people in general, just because we identify a gender that's different from the sex assigned at birth, we are forced to be classified as member of a third gender, that's a different story, which means that you are creating a kind of cleansing gender, to make gender a category just for what we call cis men and cis women, and everyone else that looks somewhat strange in regard to cis people, are allocated in that third category. That will be compulsory. If that's compulsory, then I would say it's not a good idea. If a third gender, if we talk about, instead of a third gender, we talk about a third sex, and you, or Canada or other government decide to assign people who are born with sex characteristics that vary from standard female or male to that third sex, that will be, pathologizing. It will strengthen the gender binary in the sense that only people with standard bodies will be assigned as male or female. Everyone else, even with very small differences, will be put in this box of third. So there is not a simple question, a simple answer to your question. It depends on how the economy of the third gender is going to circulate. But however, I would say that because there is a lot of interest in the issue of a third category, I think that it will really great to go opening, recognition for trans and gender diverse and gender non-binary persons, but we also need those people that name themselves as just men and women to start recognizing that their experience is also a particular experience, and for example, to start using the word cis and to start using some practices that we have in terms of recognition, saying, my pronouns are, which is a way of saying just that we are all at the same level. I was here in a panel yesterday where someone was trying to distinguish between women and trans women, and like trans people, we, in many countries, we have to have mental health diagnosis, to have sterilization, to take hormones, to go to a judge, to get permission to be recognized as a man or a woman. And nevertheless, we still are recalled, differentiated between men and women and trans men and women. So why is that difference? Really, the third gender that we need at this moment is cisgender. Cis people saying, I'm a cis man or a cis woman, and for the UN, for example, to start talking that language, saying instead of distinguishing, as I heard yesterday, between traditional women and trans women, just say that cis women, trans women, cis lesbian, trans lesbian, cis gay men, trans gay men. It's a way of everyone gets a prefix. So in that sense, we will be I don't know how to say this, introducing democracy into the gender language that we are speaking. And of course, there will be more room for creating third, fourth, fifth genders.
Thank you. Vivian?
Thank you, everyone, for the comments and questions. I'll briefly say that I believe the shared experiences that happened in this room are part of the memories and existences that we believe can create a new world. So I thank you for sharing such personal stories, and I really get emotional sometimes when I hear those, even though I haven't passed through many of the things trans communities go through. So I really feel that, and I thank you for that. I have a comment following what Mauro said about the third gender. I think this has relation to what marginal stakeholders can or cannot be a part of those discussions. Corley Driscoll, which I cited during my participation, that person also says that even True Spirits is a westernized simplification of a plurality of peoples within North American societies, and how can we have those stakeholders to really participate in those, how gender markers in documents are going to work, right? And I know Canada has a history of problems in documentation of indigenous community, Native American communities, so I think this has to do with these dynamics of power. And this has to do with colonial projects in the sense that those knowledges were attempted to be eliminated from societies and cultures. Just a final comment. On the first comment, I didn't get your name, I apologize. But I think this relates to one of the paradoxes Mauro commented on, right? On one side, we are pathologized for our identities as we are, and when we try to access mental health services because of the consequences of transphobia, of cis-sexist society, we have difficulties and obstacles to access that within, for instance, languages like comorbidity and stuff like that. So not coming from healthcare, from healthcare areas of knowledge, but I feel that this is not the best science possible, and yeah, we shall dismantle that, I guess. Thank you.
All right, thank you. So the previous group has been eating 5 or 10 minutes of our time, so we'll try to pass that on to the next group. We'll try to be finished in like 10 minutes to give the remaining persons who want to make an intervention the opportunity to intervene, and then with a request to the panel of being right to the point in the response, we'll try to conclude with a 1-minute intervention by each of the panelists. So who wants to comment or pose a question, and please come to the point, please.
Thank you. My name is Julie Kofod. I'm from the Permanent Mission of Denmark to the UN in New York. Congratulations, first of all, on a very interesting panel today, and congratulations on the upcoming anniversary on the establishment of the mandate of the independent expert. So I had a question building on some of the things that the Special Rapporteur said, and also actually the independent expert, who at the outset underlined the necessity to speak to also those who were less supportive, as everybody, it seems, at least in this room, are. And in my conversations and negotiations in New York in the Third Committee on Human Rights Resolutions, one of the issues that keeps coming up is whether or not it's a choice to be trans, or are you born this way? And I was wondering if you could give some insight into whether or not they're, in the aftermath of psychiatry and medicine, transitioning away from pathology? Has there emerged any type of accurate science on what it means to be trans? And in either case, is that important? Should it be important? Is that something that's helpful for the conversation in order to garner more support outside of just this room and the other traditional supporters of this agenda? Thank you.
Thank you. Then I saw a hand from Sherazad. And then, all right. And then your hand. All right, please.
Thanks to all of the panelists for really fantastic interventions. It's really exciting to be here. So I was just thanking the panel for really great interventions. My name is Sherazad Kara. I'm an independent consultant and advocate on LGBTI human rights issues. And one of the things that I just really wanted to bring attention to in this room was the fact that there really is no ambiguity at this point as to where these issues fall under international human rights law. That emerging jurisprudence is unequivocal, that medical classifications are abusive, and that the pathologization of trans identities is abusive. And this has been noted by treaty bodies, by special procedures, by the Office of the High Commissioner for Human Rights, as well as by regional human rights mechanisms, including the Inter-American Commission and the African Commission. They've all recognized that pathologization is a root cause of violations faced by trans people, that it's medically useless and discriminatory. And there was a joint statement that came out last year on IDAHOT, May 17th, which stated that states should reform the medical classifications that pathologize trans identities and expressions, that states should adopt measures to prevent, investigate, and prosecute all forms of forced, coercive, and otherwise involuntary treatments and procedures on LGBT persons. So I really don't want anyone to leave the room today with any sense of ambiguity or ambivalence as to where international human rights law stands on this. It's very, very clear. It's against international human rights law. Thank you.
Thank you for that perspective. And then there was a question over there, or a comment.
Yes. Do you hear me? My name is Waleska Pareja. I work for International Network for Human Rights. It's a small NGO based here in Geneva, and we help local organizations from Latin America to engage before the UN mechanisms. And in this sense, we have helped and support various organizations, LGBTIQ organizations, to come here and advocate. Well, I guess come it's a very ambitious word because of the lack of funding, they wouldn't be able to come here, and we have to represent them. They denounce, of course, the sexual reorientation or dehomosexualization therapies. I don't know even how to pronounce it because it makes me sick. But in Spanish, they are called clínicas de deshomosexualización, which is, of course, these kind of hospitals that actually treat drug addictions, but they also offer to make people heterosexual. So even the CAT committee, they made a recommendation regarding this issue, and they are concerned of the allegations of this involuntary placement in ailment of lesbian, gay, bisexual, transgender persons in private centers. There are more than 300 centers. Only 24 have been shut down, but actually the government saying that this took place, but they are reopening with another name. Or actually we don't have any convictions related to this kind of torture in these centers. Sexual violence, it's one of the therapies to actually make lesbian women like penises, so this is just unbelievable. The Committee on the Rights of the Child also provides some information regarding LGBTI children, and in the list of visions they are asking about what's their status. We have found that there's a lack of funding for LGBTI organizations, especially if they are not aligned with the government or if they are not the traditional voices from Ecuador. It's very hard to have new organizations that are working in the field. It's mainly basically HIV or gay organizations. The other ones have no funding. They have lack of information. actually it's only my organization that is sharing with them the reports, the resolutions, the final observations of treaty bodies. So this is also a challenge. And I guess there's also a lack of coordination between all of these organizations. So my question is to the independent expert and also to the rest of the panel, how can we actually give some hope to these organizations that are working in Ecuador, in the whole Latin America region, and how they can engage before the UN and the different mechanisms? Thank you.
Thank you. I was seeing one more hand, two more hands. Okay, 1 minute per person, please. Come to the point, and then we give it back to the panel. It was Ksenia and Arvind.
My name is Ksenia. Thank you for all the presentation. I'm working on treaty bodies and special procedures at ILGA here in Geneva, and we are working with local activists from all the regions to help them to bring their problems and issues and challenges, including on conversion therapies and challenges faced by trans communities here in Geneva. So if my colleague I would be happy to chat about this later. But I would just flag one interesting, to my view, development, recent development by CRPD, the Committee on the Rights of Persons with Disabilities, because after the review of Iran this year, already in January or February, they started to make point not only to persons with disabilities, but also to persons who are perceived to be persons with disabilities, specifically with regard to coercive medical treatment towards trans people and conversion therapies towards lesbian and bisexual and gay people. So I think it could be a really interesting point for different activists and also international mechanisms to flag this, to use in their advocacy. Thanks.
Thank you. So the others are already waiting outside. 30 seconds.
What the panel has made evident is pathologization is also a violation of human rights. The question to the panel is, why is it so difficult for us to establish this norm? Is it something like a public-private divide? What is it about the medical profession or this rather structure of medicine that it's very tough to get in within human rights legal framework?
Oh, thanks for that easy question as the last one. I think 1 minute each to respond, this time from the other way around.
Thank you for the comments and questions. I'll comment briefly on two of them. On the definition of trans, how do we become trans? What are trans identities, right? I think there's a question of what science are we talking about when we think about that. Feminist theorists and practices have been dealing with the questions of sex and gender, for instance, right? Regarding sex as also a social cultural construction. So, I mean, there's hierarchies amongst knowledges in sciences and cultural studies. Decolonial thought has not been on the table to discuss these issues, and there's a reason why. There's a political economy in sciences. I guess this is important to point out, I guess. And regarding clinics for de-homosexualization, I don't know. And I would like to point out their usual affiliation with religious institutions. And that is not for me to say that it's not to talk about religious freedom, but to talk about a political economy as well. In Brazil, religious institutions are associated with lobbying for the educational system not to mention gender identity or sexual orientation in their policies, educational policies. So there's also a political economy there that we need to criticize and hopefully, change. Thank you. Sorry.
Okay, I will try to be very brief. On the issue of torture, I understand the argument about gradualism, but we also need a point where accountability starts, functioning. So, like, to draw a line. So we can say, in the next year, 10 years, 100 years, we need to work to dismantle torture, but they will need to be a day when torture become, impossible to be accepted in gradual terms. whatsoever. In terms of science, I really believe that science is very important for this debate, but in the sense of showing that trans people that are legally recognized and have access to gender-affirming treatment are doing a lot better, and they live in welcoming societies than those are deprived of those rights. When it comes to be about human rights, it doesn't matter, how people are who they are. I spend most of my activist life, or not most, but a lot of my activist life reading definitions produced by different agencies. We have definition about what is trans, what is gay, what is lesbian. There was never a definition of what is a woman. So in that sense, it's equally irrelevant. So when we think about women's rights, no one is asking, but how do you choose to be a woman, or just you just were born that way? It's about rights. So in that sense, science is really important. Just a moment. It's really important to assess how people are doing in terms of rights, but just that. I don't have an answer for Arvin's question, but what I can say is that Ehrt is going to release later this month a wonderful report produced by Scheherazade Kara, who is just behind, exactly on that issue, on pathologizations and human rights, and we really hope that report to ground the introduction of pathologization as a key human rights issue in this context.
Final words from my right.
Just my comment is about science. If we live just by medicine without control, it becomes dangerous. Remember these stories with female athletes. If they are so very good, so all these attempts were made to find criteria if she is really female or female enough, and then they all failed, and the only way is to ask the person who you are. So this is about science, but social science and human rights should be not forgotten, should be reminded also always to biomedical science.
I think we need to cut it, so it's 30 seconds for Vitit to respond, and then we'll need to really leave the room.
Special procedures, number 1, global reports, engage with. Number 2, country missions, engage with. Number 3, communications, allegations, engage with. Number 4, general interaction, possible informed visits to countries and so on. Those are ways of interacting with us.
All right. Thank you for the right to the point, and I'd ask you to leave soon, and thank you to the panel and the good discussion.
Thank you.